Thanks for tuning in to the Red Clinic podcast. I'm Dr. Schwalen, licensed psychologist and expert in the treatment of eating disorders. Today, we're going to do what we do best, and we're going to provide education to you. What I want to do today is focus on the question that I actually get quite often from friends, family, clients, just people out there in the field who are trying to help those with eating disorders is how do you talk to somebody, especially a child, if you're concerned that they have an eating disorder? And so this is a great question because there is so much involved with trying to have a conversation with your child, especially if you're a parent out there, and you're trying to navigate keeping your child safe and then doing what's in their best interest and trying to figure it all out, right? There's just so many unknowns. And so this is a very common thing that a lot of people think about and want to know about. The first thing that I want to put out there is that eating disorders is one of the most dangerous types of psychiatric illnesses. We know that those individuals, especially with anorexia, have the highest mortality rate of any psychiatric illness out there. So it's usually adolescent females that tend to die from eating disorders, but boys die from it too. And so when I say they have the highest mortality rate, I'm talking about death, right? Death from an eating disorder. And the death rates are higher than other diagnoses like depression or anxiety or bipolar disorder. So we're not just dealing with something that isn't serious. Eating disorders are very, very serious. And usually when a provider, whether that be a pediatrician or another type of therapist or clinician, are recommending treatment for an eating disorder, they're not doing it in a very light way at all. They're being very serious about their recommendations. For the most part, providers are going to do what they can to keep patients in a very, the least restrictive environment, right? So providers are always going to do what they can to keep kids from being hospitalized. Usually that's the mindset of providers. So if they're mentioning to you that they are so concerned that a hospitalization is required, or they're just concerned about an eating disorder, or if you are concerned about an eating disorder, it's really important to talk to your child about that. Brushing it under the rug or being in denial is not what's going to save your child's life. So when treatment is necessary, or if you're concerned about an eating disorder, talking to your child can be really difficult. A lot of times I talk to parents who are just too nervous to bring it up, or they're worried that they might not say the right thing. They are concerned about what their child's reaction might be. These are all really normal types of concerns, right? But when we're dealing with something as serious as an eating disorder, I'm always going to recommend that we go towards that topic rather than shy away from it. Some of the tips that I have for you today will really just focus on how to communicate about difficult topics and in general about eating disorders as well. So anytime you're trying to have a difficult conversation with a child, it doesn't matter if it's about an eating disorder or about something else, there are some tips out there that researchers and other providers generally recommend. When you're about to go into a difficult conversation or maybe deliver some difficult news, it is very key to be assertive. So what is assertive communication? That can be really hard for a lot of parents. A lot of people in general, not just parents. I know many clients that I work with, when we talk about what is assertive communication, people mistake assertive communication as being aggressive. So I'm going to actually take a second to break down the different kinds of communication that are commonly used in your day-to-day interactions. And then we're going to highlight what assertive communication looks like when you're doing that with your child. So let's start with the obvious, the more extreme type of communication, aggressive communication, right? So aggressive communication is characterized by things that would be aggressive. So those are things like raising your voice, maybe throwing things, name calling, walking out and yelling. It could even be things like stonewalling, which is the silent treatment. Those types of communications are considered to be aggressive, okay? They make people very uncomfortable. It can lead to someone dominating a conversation while the other person really doesn't have a voice, and it's usually not a healthy form of communication. Most parents don't want to be viewed by their child as an aggressive communicator. So when I start talking about assertive communication, they tend to think, oh my goodness, I can't do that because I don't want to upset my child, because they actually mistake assertive communication with aggressive. Okay, so aggressive is exactly what it sounds like. It's unhelpful, unhealthy types of communication. It's raising your voice, name calling, dominating a conversation. Okay. Then you have the opposite extreme, which is real passive communication style. Passive communication is an individual who really doesn't have an opinion for the most part. They tend not to make eye contact or even express themselves openly. This individual might be the person that you might say, hey, what do you want for dinner? And they kind of look down and they say, I don't know, and I don't care, whatever you want. And they tend to just kind of blend into the background, and they're not really asserting themselves or their personality or their individual thoughts and desires. So that's what a passive communication would look like. And then you have kind of what the middle is, which is passive aggressive, which I think a lot of people have heard of, but they may not necessarily understand it very well. So passive aggressive communication is, instead of being direct and in your face with aggressive communication, it's doing that type of behavior or communicating some type of aggressive message, but in a more passive manner. So a really good example that I like to give to clients is imagine that you're in my office and you were borrowing my pen and you didn't give it back to me. And that's my favorite pen, and you have no idea how upset it makes me that you didn't think to just return my pen, right? And so at the end of our session, instead of holding the door open for you and walking out to the waiting room with you, I may respond in a very passive-aggressive manner. So I will get up and exit the office, and instead of holding the door open, I might shut the door on you and keep walking. That's pretty passive-aggressive. What that tells you is, oh, Dr. Schwalen's upset with me, but I have no idea why. What just happened, right? There is some communication there, but it's definitely not direct. And so the best form of communication, or the most healthy form of communication, is assertive communication. Assertive communication is direct and respectful at the same time. So with aggressive communication, we know that it's not necessarily respectful or calm. Sometimes it can be very chaotic. With passive-aggressive communication, we know that there's something going on here, but no one's really sure what, because we're lacking the direct component to it. And with passive communication, we don't really ever know what the person's thinking. So with assertive communication, being direct and being respectful and kind, they all go together. And it's really hard for people to wrap their head around that. Because if you're used to going through the world kind of in a passive manner or a passive-aggressive manner, it can feel aggressive to be direct. When you're not used to being direct and upfront about the way you feel or the things that you're thinking, it can be uncomfortable at first. But when your child's life is at stake, there's nothing to be afraid of when you're trying to be direct with your child about something. So being non-judgmental and being assertive are the key when we're trying to communicate a concern to your child, right? So one of the things that I really like to put out there are just examples of what this would look like. We usually recommend that you use a tool called I statements. I statements are statements that really focus on what you are feeling or thinking versus using the word you, right? So if you use the word you, it can come across as judgmental. It can come across as blaming. And it can really make the other person feel uncomfortable. But if you keep the focus more on yourself, right, and your concerns by using I statements, it takes away that like level of defensiveness that you can kind of walk into when you're having conversations with your kids. So we just teach a model of I statements. It's a basic formula. It's, I feel blank when blank happens, or because, right? And so if you're worried about your child's eating behaviors, you might say something like, I'm concerned about you because I've noticed you're losing some weight. And that concern, right, is all about your concern as the parent. I'm concerned about you versus what's going on with you. You've been losing weight lately, and I'm really worried about that, right? Now we've started it off on the wrong foot. We've made your child in that example kind of on the defensive. It's an invitation to shut down or to lash out, but it's kind of a barrier, right, to getting communication accomplished. So you can even say, your father and I are concerned about you. We've noticed that you're losing weight. We love you. We want to help you. We're concerned about some unhealthy behaviors that we've observed, just whatever that may be. But you're coming at it with a very non-judgmental stance, and you're communicating concern and love for your child so that they understand that you're not pointing fingers and you're not blaming, but you're really trying to be curious about whatever you're noticing. It's also really important to be specific. So we've noticed you're losing a lot of weight, right, is really specific versus, we've noticed that there've just been some changes in you. If you're not specific, you're not being clear and you're not being direct. So being assertive, again, is being clear, direct, which means to the point, right, specific, and also doing it in a very loving and respectful manner. It's also really great to use assertive communication when communicating with your child and with your spouse or the other parent, because it models for your child how to be an assertive communicator. You want your child to grow up being able to express their thoughts and feelings and do it in a way that comes across clearly and in a way that they're able to get their needs met without being perceived as aggressive or passive aggressive. So being assertive is a very effective technique for having difficult conversations with loved ones and for also communicating concerns to your child if you believe that they may be at risk for an eating disorder. The other thing that is really, really important to do is to, after you've kind of expressed your concerns, you've taken care to be non-judgmental and utilize a very caring tone, it's really important for you to then take action, okay? So one of the things that kids really thrive on is knowing that you are confident in whatever your parenting decision is. If they can tell that you and the other parent are not on the same page, or if they know, like, all I have to do is push here or say this one thing, and I can get him or her to back down or change their mind, they're not going to feel confident or secure in whatever you're saying to them. So having that confidence of, it's time that, we're so concerned that we are going to start treatment for you, or we're going to go for a mental health appointment because that's how concerned we are, and we already scheduled it. So being matter of fact, being confident about what your action steps are is going to be very, very important during this time. Now, obviously, opening up the conversation of, I feel very concerned because I've noticed that you're losing a lot of weight and I'm worried about your nutrition and your overall health. So we are going to go to a mental health appointment tomorrow for an assessment. All of that is going to set a chain reaction, right? Your child is going to have their response to that, and you're absolutely going to need to address it. So doing so, again, with reassurance and with confidence is so important. So making sure you've done the work ahead of time, that you and the other parent are absolutely on the same page. There is no wavering in the decision that you're making to seek out treatment, and then following through with that decision, no matter what reaction your child has. I always say to parents, when I'm working with them, I'll bring them back to, hey, remember when your child was a toddler? Try to think back to that time. When your child was 2 or 3 years old and stepped off the end of the driveway and got into the road because they were chasing a ball or they wanted to play with something that they saw, what did you do? And every parent will tell me, I didn't let that happen. I went out to the road, I picked my child up, and I brought them to where it was safe. So even if your 2 or 3-year-old was so engaged in whatever they were doing, and it set off a chain reaction of them throwing a fit and having a tantrum, right? You still took them kicking and screaming out of that road and back to safety. You were doing your job in saving your child's life. It's the exact same thing with eating disorders. If you're concerned about something as deadly as an eating disorder, you pick up your child off the road and you make sure they don't get hit by the car. So it comes back to setting limits with your child in a healthy way and avoiding the power struggle. Again, being assertive and having confidence with whatever your action plan is going to be is very important in how you communicate this. Also, it helps prevent confusion, right? So if the child is aware that both parents are on the exact same page, there's no weakest link here. There's no changing their mind. This is very clear. Your child is much more likely to go along with the plan once they've overcome the emotional response that they're having. Also, saying things to your child, this is what's in your best interest. Me and your father really agree that this is what we have to do next because we need a professional to help. We need an assessment or we need direction on where to go because this has started getting to a point where we are very concerned. Saying those types of statements can be very reassuring, even if it doesn't seem like it in the moment. Other things that you want to make sure to do during these conversations is just make sure your child is feeling safe. So they're in a good place when you decide to have the conversation. Maybe you're in your home, maybe you're in the living room or in their bedroom, but a place where they feel comfortable. So I absolutely don't recommend that you do something like this in public. And that where they have some privacy. So if there's other siblings in the home, I recommend that you have these types of conversations away from the other siblings. And this is just an opportunity for the child that you're concerned about to be able to openly speak to you without the interference of anyone else, maybe listening in or interrupting. If your child seems to be avoiding you during these conversations, it's okay to stop and say, I need you to look at me and I need us to finish this conversation. If you need a few minutes to get your head around it, go ahead and take those few minutes, but we're going to come back and we're going to finish this conversation. So being able to say things like that is really helpful when having a difficult conversation with your child. Also, if your child is, trying to ignore you or they're throwing a tantrum or they're getting very, very upset and it seems to be escalating. So if you're having any of those types of responses, again, it's okay to just set the limit and say, I know this is really difficult, right? So you give the reassurance and you validate them. Hey, it was really hard for me to even bring it up to you today, but we're in this together and we are going to get through this. So when you're ready, we will finish this conversation. But the point is that you're showing this is not a power struggle. I'm the one in charge as your mom or your dad, and I'm going to always make the best decision for you. So when you're ready, let's talk. However, we're still going to our appointment tomorrow. So those are the types of power struggle elimination types of communication that you can use. Now, the other thing I like to talk to parents about is just understanding your parental power. That's so important, right? Because so many times parents are afraid that they're going to upset their child, or I've seen so many times with eating disorder clients, families get to the point where they're walking on eggshells with each other. They're tiptoeing around, they're doing everything they can to not upset one another, or everybody kind of just turns the other way when they're noticing these very concerning behaviors. And so helping parents just understand, you honestly, as the parent, have one of the most influential positions in your child's life. You have so much power over how confident and secure your child will feel based on how you model that for them. So even on the inside, I always say be like a duck. If below the surface you're really nervous and uncertain, your child doesn't need to see that. Above the surface, you can look, calm, cool, and collected. And it really helps when both parents are on the same page, because then you can back each other up and consistently be that broken record for your child. So no matter what resistance they give you, or no matter how they try to convince you that they'll change, they'll start eating, and even that night they might have dinner because you have let them know about your concerns, they're still at a point where they've shown you over a course of time that they really aren't able to turn this around on their own. Because if they were able to, they would have done so by now. It wouldn't have come to this point, right? That you would even need to bring up your concerns, that you would even need to make the appointment to go get help. So you have to trust your instincts. You have to remember that you are the adult. You have logical thinking ability and critical thinking skills, that you are not crazy for thinking there's a problem, that you understand your child better than anyone else does. And so you have to also understand that your child's going to do what they can to try to talk you out of it, and be ready for that. We also know that if you avoid treatment, or you drag it on, or you don't listen to the professionals, if you have pediatricians or therapists who are concerned that maybe a higher level of care is needed, that you're setting your child up for struggling with this eating disorder for much longer than they have to. The cool thing about kids is that they're resilient. They can really bounce back from things very quickly if we give them the proper opportunities to do so. So getting your child the treatment that they need, the sooner the better, is very, very true. Because the more time that goes by without the proper treatment, the more time the eating disorder has to set in and become more ingrained with your child's personality as they grow and develop. But if we can intervene earlier, the much better likelihood of recovery your child will be set up for. So just know that, like, the short-term pain, right, of having to have these difficult conversations with your child and having to stand your ground because you know what's in their best interest, has so much long-term gain that you're setting your child up for. Other things that I just want to be able to say about, putting your skills into practice. We've kind of broken it down in terms of what are the differences between the communication styles, and how assertive communication can feel aggressive if you're not used to doing it. But if done correctly, where you kind of focus on I statements, you're very clear and specific, and you're still very caring while you're doing it, it can be very effective. It can come across like you are very confident and you know what you're talking about, and you're not going to waver from what you truly believe is in the best interest for your child. So using those skills is so important. But doing it with the support of your spouse or the other parent is very important also. So rallying up that support before you have this conversation with your child is key. They cannot see that there's a weakest link. You have to present as a united front. If the conversation's still too worrisome, you can absolutely get a professional involved. You can get a therapist to help you have this conversation with your child. You can call a professional and ask them for their support during this time. Professionals are very good at delivering bad news. They have to do it quite often in the mental health field, in the medical field. And there's a lot of research on ways that are most effective. The research is really about how to be direct and use the communication strategies that I've talked to you about today. And then I like to always leave parents with this idea of your own self-care. So I know life is busy. I know you're juggling 100 things all at one time. And so I like to recommend just easy ways to kind of take a mental vacation. Literally, that's one of the coping skills I like to recommend, because we don't necessarily have time all the time to go out and take that vacation or get that massage or take a long bath or whatever it may be. But for 5 minutes, you can close your eyes and take a mental vacation. Just take that break if you need it before you gear up to have a difficult conversation. So there you have it. That's it for the Red Clinic podcast today. Thanks for joining, and I hope you tune in next time.